Colon cancer is frequently referred to as the silent killer, since symptoms may not appear until the tumor is large enough to cause issues. In the United States, colon cancer is the third most frequent disease in both men and women, and is responsible for over 100,000 new cases and close to 50,000 deaths each year. While there is no way to predict with certainty if colon cancer will develop, there are some early symptoms that might point to a problem. Colon cancer is a condition in which the cells in the large intestine become abnormal and multiply uncontrollably. With that said, let's get started and discuss the 9 early signs of colon cancer. Some of the signs mentioned in this video may be subtle, while others may be more obvious. Before we continue, please note that everything mentioned in this video has been objectively fact-checked and reviewed by licensed healthcare professionals. Number 1. Change in bowel habits. The average age at which colon cancer is most likely to develop is 60. Bowel habits are frequently the first indicator of colon cancer. And while it can affect people of any age, half of those diagnosed are over 65. If you notice any changes in how frequently you go to the bathroom, or if your stool becomes hard and difficult to pass, it might be something to be concerned about. A healthy colon typically has regular bowel movements every day or two. The stool should be soft brown and easy to pass with no blood. Number 2. Chronic diarrhea. People with colon cancer frequently experience diarrhea or loose stools. The National Cancer Institute states that some people may experience diarrhea because their colons are infected with bacteria or parasites. Technically, diarrhea is defined as the passage of 3 or more unformed stools in a 24-hour period. Diarrhea is a symptom that can also be caused by other conditions including irritable bowel syndrome, lactose intolerance, and inflammatory bowel disease. Number 3. Constipation. It's no secret that the colon is in charge of waste elimination, as well as the absorption of water and nutrients from the food we eat. This can result in a situation where the colon becomes clogged and unable to function properly, which can cause constipation and can be quite uncomfortable and embarrassing. Although constipation may not seem like much of a problem at first, it can be an early sign of colon cancer. In fact, one study suggested that constipation may be a sign of colon cancer. Constipation can be brought on by a number of factors, such as drug interactions and a lack of exercise. Occasionally, it can be difficult to distinguish between common constipation and more serious conditions like colon cancer. Consult your doctor if you have constipation that lasts more than 3 days, especially if other symptoms like bloody stools and abdominal pain are also present. Before we move on to the next symptom, if you're enjoying our video so far, don't forget to hit the like button and subscribe to our channel so you won't miss any of our future educational videos. Number 4. Blood in your stool. Colon cancer is one of the most treatable tumors if it is found early. Unfortunately, 1 in 20 Americans may develop colon cancer in their lifetime. The earlier it is found, the higher the chance of surviving. Over 5 years is 95%. Blood in the stool may be a precursor to colon cancer. Bloody stools can be caused by a variety of cancers as well as other disorders like ulcerative colitis, diverticulitis, and hemorrhoids. The colon is the portion of your digestive system that collects stool before it is evacuated from the body. Blood in the stool is typically caused by inflammation or injury in the large intestine, but it can also result from bleeding from other areas of the digestive tract, like stomach ulcers. Some medications, such as antibiotics like ciprofloxacin, antidiarrheal medications like lactulose, or iron supplements, can also cause blood in the stool. Number 5. Rectal bleeding. The presence of rectal bleeding could indicate colon cancer. Your large intestine's rectum, which is the final section, and measures about 5 inches long, is where waste leaves your body. Bleeding from the rectum is pretty common, although most people who experience it do not have colon cancer. Hemorrhoids and anal fissures are 2 other disorders that can cause bleeding in this area. Another factor contributing to rectal bleeding could be a polyp or other growth on your colon surface. Number 6. Bloating or pain in the abdomen. Stomach pain or bloating that is not explained. Genetics or way of life decisions, including food and exercise routines, might result in colon cancer, increasing your risk by up to 30%. 10 to 15% of colon cancer occurrences are inherited, while other factors including obesity and a poor diet also play a role. Drinking and smoking increase risk by 5% to 10%. Increased bloating is one of the most typical signs of colon cancer. It can happen in the early stages of the disease or be a sign of other ailments unrelated to cancer. Bloating is a sensation of fullness or swelling in the abdomen that can be brought on by gas, certain foods, or prescription drugs. try eating smaller meals more frequently throughout the day, instead of 3 large meals every day if your stomach feels bloated after eating. This will help reduce bloating brought on by overeating and should also help stabilize blood sugar levels. Number 7. Constant exhaustion. Feeling tired is quite common and can be brought on by a variety of things, such as staying up late or not getting enough sleep. But if you experience it more frequently than usual and it persists even after a good night's sleep, it may be an indication that something is wrong with your body. The colon is in charge of eliminating waste from the body through the stool. And when this process becomes obstructed or slows down, it can cause fatigue. If you frequently feel exhausted and experience any other symptoms, such as bloating or abdominal discomfort, this may be an early sign of colon cancer. Toxic buildup in the digestive system can happen if this persists over time. It can result in malignant tumors in the colon wall. Number 8. Sudden weight loss. The symptoms of colon cancer change based on the location and stage of the tumor. Although sudden weight loss can be an early sign of colon cancer and other gastrointestinal conditions, it can also happen for other reasons, most notably if you're an older adult who has recovered from an illness. If you lost more than 10 pounds or 15 pounds over several months, however, this could be a sign of colon cancer. Number 9. Feeling full often. Eating a nutritious diet can reduce your risk of getting colon cancer, but that might not be enough to avoid it. Exercise is also important. Bloating, constipation, diarrhea, and other digestive problems can be caused by colon cancer. These symptoms are typically mild at first and are typically easier to ignore or dismiss than other symptoms of colon cancer. Eat healthy, exercise, and maintain a normal weight since these actions will keep your colon clean and help avoid the condition. If 2 first-degree relatives have had colorectal cancer before age 55, you have an even higher risk than average of getting it yourself at some point in your life. If 1 first-degree relative, such as a parent, child, or sibling, has had colorectal cancer before age 55, you have a greater risk than average of developing it yourself at some point in your life. Compared to other races and ethnicities in the United States, African Americans have a higher risk of acquiring colon cancer, although this may be due more to availability to screening tests than to biology alone. In addition, if you have any of the risk factors for colon cancer listed above, be sure to discuss with your doctor whether colonoscopies would be the best option for screening. If you have any of the symptoms listed above, do not wait to contact your doctor, as they may be early indications of colon cancer rather than definitive symptoms. If you like this video, then press the like button and subscribe to our channel for more educative content.